Thinking of owning your dream homes? EJ Investment is here for you. Secure our quality bungalows with 2, 3 or 4 bedrooms, or our story buildings 3 or 4 to 5 bedrooms at very affordable prices with flexible payment plans at our Sanyang Seaview Estate, where you can enjoy the cool breeze with modern infrastructure such as tar roads, covered drainage system, modern electrification with street lights, gated entrance with security posts, and social amenities such as gas station, shopping mall, medical clinic, park, schools, children daycare, and a lot more. Our dedicated team of professionals will keep the estate clean at all times, provide security and patrol team within the estate premises, install latest technologies such as CCTV, Wi-Fi, home network installation, solar panel, and power backup system. Also, check out for our additional home facilities and interior design service such as premium tiling, wall plaster, home landscape, fingerprint home lock, and a lot more. Visit our office at Senegambia Kololi Highway and get a free site visit tour, or contact us on 4464-838. WhatsApp us on 3259220. Or you can visit our Facebook page or Instagram on EJ Investments. EJ Investments, we are first in properties.
All right.
Honey, did you remind him that the last time he sent the money, it was not enough to buy all the provisions?
Oh, sorry, I forgot to tell him.
Are you guys talking about money transfer to buy provisions?
Yes.
But don't you know about Baluwo?
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 What is Baluwo?
Baluwo is a service that your son can use to send provisions directly to you guys from the shop. And you don't have to worry about the exchange rate.
Tell me how Baluwo works.
It's very simple.
Just log on to baluwo.com and shop, or download the app on your phone. You can shop on the website or using the app to buy online basic products for your family and friends. With Baluwo, you decide what your money is spent on. Your money, your choice. Buy online products for your family and friends in the Gambia, Senegal, Nigeria or Mali. Baluwo, better than sending money.
Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome Gambians and viewers wherever you might be following us across the world. This is Concerned Youths of Gambia for Health. It's an organization that came into being as a result, supporting the Ministry of Health and Social Welfare. As we know, currently, the COVID-19 is a concern not only in our country but global. So it's 5 youth organizations came together in supporting the ministry to fight against the COVID-19 in our country. Today we are here and we will be taking you in deep into our plans and activities that we are going to embark on in working to support the ministry so that we can eradicate the COVID-19 in the Gambia.
Jibril Gandobalde here once again with you and try to discuss the COVID-19 situation in the Gambia in collaboration with Concerned Youths of the Gambia for Health. As we all know, since the 17th of March 2020, the Gambia registered its first case of the COVID-19 pandemic, which started in Wuhan, China, 2019, December. So since then, 17th of March 2020, up to date, today that we are giving you this report, now the Gambia have recorded a total number of 2,963 cases since our first reported case in 17th March. But looking at these figures, what we are seeing in these figures is that as we have been told by our statisticians that majority of the cases that we are having are between the age of 40 going down, because going by our statistics as we speak right now, when you look at the number of people who have the virus who are between the age of 50 going down or 40 going down, is almost 60 to 65% of our cases. what we can understand from this is that then most of our cases are really affecting the youthful population, which is from 40 going down. So that being the case, we are appealing to everybody out there, especially the elderly and the youths in particular, to help us in this fight against COVID-19. And how can youths help in this fight against COVID-19 is one of the things that this youth group, that is Concerned Youth of the Gambia, is embarking on for health under their chairperson, Mr. Abubakar M. Kujabi, and their spokesperson, Mr. Wali Sen, and the program coordinator, our Jase. So we are really happy to collaborate with such youths. We have 2,900 plus cases in the Gambia. Yes, but if you see the distribution of these cases in the Gambia, we have also noticed that 65% of the cases that we have in the Gambia are youths, and meaning they are from either the age of 40 going down or 50 going down, which is very alarming, going by the statistics that we have currently. Because if you look at our data, people who are 70 years and above, less than 120 people are infected with the virus. That is the people who are above the age of 70, 80, and 90 plus. These are a total of 115 to 120 people infected. But if you look at the people who are infected that are between the age bracket of 30 and 40 alone, only the male category, we have 475 people infected. And in the female category, still in the age bracket of 30 and 40, we have 311 female infected. And when you go down below further, from 20 to 30 years, we have 386 male infected with the virus, and then 401 female infected with the virus. So only these two age categories will give us around 1,000 number of cases that are between the age of 30 and 20 or 40 and 20. So which is very alarming. So we are very much happy to associate ourselves with youths who have recognized this problem, that the bulk of our cases that we are having with coronavirus are among the youthful population. But what is the question? But who are suffering most from coronavirus infection? We all know it's not the youths. The youths, yes, they are having the burden of the cases in the numbers, but when you come to the actual problem or the actual death that is related to coronavirus, most of the people dying are either at the age of 60, 70, 80, and 90. These are the people who are mostly immunocompromised, meaning they are already confronted with diabetes, hypertension, and other cancers or heart problems. So when these kind of age category people are infected with the virus, basically they tend to suffer more, and we as youths, we owe it to these people, because these are the people who gave birth to us, took care of us from the cradle, educated us, clothed us, fed us, up to the point that we can be able to do things for ourselves. So I'm appealing to every youth out there through Concerned Youth of Gambia for health. If you are a youth and you are a concerned youth for the health of Gambians, especially for the health of elderly, because we all know this coronavirus, yes, it kills youths, that is a fact, but the people that it kills most are not the young ones, these are the elderly. So we are appealing to everybody out there through Concerned Youths of the Gambia for health to join this fight and help us to make sure that the population out there is aware. Because we all know coronavirus, yes, it's true, it doesn't have any cure. But what we have is the prevention, and as you can see, there are a lot of preventions that are outlined out there. for us to be able to contain the spread of this virus. Number one is to make sure that we avoid shaking hands. Shaking hand, because the hand is a vehicle that can carry the virus from many places into mainly the entry points where the virus can enter your body, which are the eyes, the nose, and the mouth. So this is a number one preventive aspect, to avoid handshaking. It is also said when you are coughing or sneezing, make sure you cover your mouth. But now we have even passed that stage. What we are told to do in the Gambia, when you going out, make sure that you put on a mask. But if you are not also out and in your own home, or you are isolated, you cough or sneeze, make sure you cover your mouth or your nose. And number three, we said let people try to make sure they wash their hands thoroughly. They wash their hands with water and soap. And this hand washing, people should understand that it's not just hand washing that will have to do with only water alone. You have to apply both water and soap to make sure your hands are washed properly, and the process that involves the steps, we have to know the steps. When you are washing your hand, first thing, you have to make sure you apply your hand sanitizer and you rub against your hands. When you rub against your hands, then you interlock your hands like this. You rub between your fingers, then you go at the back of the hand, you rub at the back of the hand. Whatever you do for this hand, you have to do for the other hand. And if you are ready, you rub your thumb, big finger, and then your fingernails. Everything should be properly done up to the wrist, up to the point you finish the hand washing process. And now we are also encouraging people, especially the young ones. If you don't have any business outside, please stay home. Because why we are saying stay home is we don't want the young ones to go out there, catch the virus, and come and bring it into the compounds or into the houses where they have their grandmothers, grandfathers, their fathers and mothers, uncles, who are elderly, who are immunodepressed, they are already having diabetes, or they are already having high blood problems. So these are people who are high-risk people. And to avoid infecting high-risk people, we all have to play our part. Because coronavirus, the fight is a two-way fight. We all have to understand this. Government have a role to play. Health workers, for that matter, specifically have a role to play, and we are playing that. What is that role? Government is responsible to make sure people are tested, people are quarantined, people are isolated, people are treated, people are followed up, contact tracing is done, surveillance is done. Government is doing all this, and is the responsibility of government. But the responsibility of the population also is there on the other hand. We also have to take responsibility of this. Wear masks. It is mandatory now to wear masks. So the population have to make sure that when they are going out, it is mandatory, they have to get their masks with them. And that one, the government cannot do that for you. You, the population, you have the role to play in that, to make sure that you are responsible. Because we all know the high-risk people, we all have people who are high-risk, because we all have elderly people. So that being the case, we have to be responsible. Wear your masks. Where your masks should be worn, people should understand this. Where physical distance cannot be observed is where you have to put on your mask. But if you are in your car alone, you can be without a mask. If you are walking alone, you can be without a mask. But anywhere where you know that there is a crowd, and a crowd starts with 2, 3, 10, 100, up to 1,000 people, you have to make sure that whenever you are going to such environments, you have to put on your mask. So this fight, as we said, it's a two-way fight. Government have to fight it, but the population have to fight it. And then we have to come together to make sure that we defeat this common enemy, because this is a global pandemic. Every country on earth is fighting this virus. And we cannot fight this alone as government. We cannot fight this alone as Minister of Health. We cannot fight this alone as risk communication. We need partnership. And this is what we are getting from concerned youths of the Gambia for health. because they are youths who are concerned about their own welfare, who are concerned about their parents' welfare, their country people or fellow people's welfare. That's why they came together to partner with the Ministry of Health through the risk communication and community engagement, which we are very proud of, to partner with such kind of youths who are out there to make sure that they strengthen our efforts. We cannot be everywhere, but these youths are everywhere. And when we made the problem noticeable to them, that the bulk of our cases, majority, 65% out of the 2,900 cases are youths. So they took it upon themselves to make sure that they sensitize the youths. How they get to the youths? They use different platforms. They have radio programs, they have TV programs, and they're using their internet, their social media platform, all to make sure that they are sensitized. So anybody out there who can support such laudable youth groups, it is very welcome, and we will like people to come out and support these people so that they can help us reach to places that we as Minister of Health or Risk Communication cannot reach. Because we are also seeing now many youth groups are coming up and they are partnering with us to support us. Some, we don't give them anything. They will buy their own fuel, they use their own vehicles, they only come, we give them posters or megaphones that they will use to, do the sensitizations, and they will go in. We have also seen a similar youth group that is from Misira in Brikama. Those people also, they have gone around the whole of their neighborhood to sensitize the community there as far as preventive measures are concerned with regards to COVID-19. So we are appealing to every responsible youth out there to make sure that if you don't contribute in making your voice heard, contribute in making sure you follow the advice that the Ministry of Health and WHO is giving out there. So mbokk yi ma mun a profité rek pour jaar si local language bi pour suñ mbokki déglukat yi ak seetaankat yi ñu mun see njëriñoo comme anglais bi ñëpp nekkuñ ne loolu lañ fi nampa si biir dëkk bi. waaye li ma doon waxtaanee rek mooy ne Ministry of Health through the risk communication and community engagement under the leadership of Mr. Modou Njie moom moo ñu digal pour ñu waxtaan ak askan bi lu jëm si concerned youths of the Gambia for health si seen jàppale buñ nekk di jàppale Ministry of Health ak risk communication and community engagement department bi pour make sure ne nit ñi si biir dëkk bi am nañ xibaar bu doy, nit ñi am nañ information boo xam ne moom lañ soxla pour mun a dunda coronavirus bii nii mun a mucca feebar bii nii lembee aduna di coronavirus. Ndig ñun yëpp réeréewuñ mbir ne comme ni ma ko waxee si anglais Gambia dëgg la fu mu toll nii depuis 17 of March 2020 ñu doog a am suñ first case ba tey bu ñoo wax ak askan bi nii tey fuñ toll nii tey mooy ne 2,000 juróom-ñeneenti téeméeri nit ak juróom-benn fukka ak ñetti nit ñoo am jàngoroy coronavirus si biir réew mi fii. waaye lan lañ jàngat si nit ñi am feebar bi nii ne su nekkee ne xaaji téeméer la juróom-benn fukka ba juróom bi yëpp su nekkee ne ñu ko am ñëpp téeméer la juróom-benn fukka ba juróom bi yëpp lu si ëpp doole te moo ëpp doole si téeméer bi xaaj bi mooy ne ndaw lañ mooy ne ñu ngi nekk diggante ati ñeneen fukki at demee ko suuf fanweeri at ñaar fukki at ak jëmee loolu suuf. loolu nag nekk na loo xam ne ndaw ñi war nañ see jànga ndaw ñi war nañ ñoom it taka seen tànk tubéy pour gis ne feebar bii nii ñoom nekkuñ ñu ci ëppale après nekkuñ tamit ñu ko dugal si biir kër yi ba ñoo xam ne ñooy suñ papa yi suñ yaay yi suñ maam yi suñ bàjjen yi suñ nijaay yi ba ñooñu ñu mun leen a wàlla feebar bi te xam nañ ne ñoo xam ne dañ féetoo mag soo ko bàyyee xel tey nu ñoo wax ak yéen ni juróom-ñeneenti fukki nit ak ñetta ñoo jota ñaaka seen bakken si biir réew mi fii nii lu jëm si coronavirus te soo seetloo 93 people yooyu noonu yëpp ba 96 people yooyu yëpp nga gis ne 75% bi lu si ëpp doole su nekkee téeméer raxaaj bi juróom-ñaar fukk ak juróom bi yëpp lu si ëpp doole ñu féetoo mag la mooy ne juróom-ñaar fukki at juróom-ñetti fukki at ba juróom-ñeent fukki at lañ am ñu ñàkk seen bakkan kon loolu suñ ko buggee changer kon ñun ndaw ñi la ñoo mun a waxal because ndaw ñi soo ko seetloo si 2 junne kees yi ñu am yëpp ak juróom-benn téeméer nga gis ne ndaw ñi ñoom ñoo si gën a bari la kon feebar bi suñ buggee suñ papa yi suñ yaay yi suñ maam yi suñ baajan yi suñ nijaay ñu mucca si kon ñun ndaw ñi foog ñu jëlee ko seriously ñun ndaw ñi foog ñu aar suñ boppa ndig ñun ndaw ñi ñun ñooy ñooy dem si génn si kër yi dem si marché yi dem si garage yi dem si béréb yi nit yi di dajaloo si office yi ak place yooyu xalaat ndaw ñi ñoo amee kattan ñoo amee doole ñoo faa dem te su boobaa loolu firndeel nañ ne ko si suñ report bi ne ndaw ñi ñoo ëppa si ñu am feebar bi si biir réew mi waaye soo ñëwee si beneen anam nga gis ne ñu dee gën a loru si feebar bi du ndaw ñi so loolu war a tax nag kon ndaw ñi ñu war a bàyyi seen xel ndig ñamit dañ am responsibility because sa papa jur la wala sa yaay mu yar la mu dundal la ba nga mag toolu nii munal sa boppa yow it comme foog naa war na la pour yow it nga mën koo mun a teral mun koo toppatoo mun koo mun a aar si lu jëm si loo xam ne loraangeem la te luñ jàngat depuis balaa feebar bi ak si fii sax Gambia mooy ne feebar bi ñu dee gën a faagaagal ñu dee gën a rey mooy ñoo xam ne ñu ngi féetoo mag te loolu lañ gis bu dugga see Gambia because rey na fu mu nekk nii 96 people si biir dëkk bi waaye da ngaa gis 75% bi yëpp li si ëpp yëpp ñaareel dañ nekk nit ñoo xam ne ñu ngi féetoo mag ñum rey ñoo xam ne ñu ngi ñeneenti fukki at dem si suuf soo ko xaymaa ëpput fukki nit kon loolu luñ see jàngat kon mooy ne ñun ndaw ñi am nañ responsabilité bu mag pour gis ne feebar bii nii naka lañ ko mën a xeexee ndig ndaw ñi si la ëppee kon suñ ko xeex bugga koo daan kon ndaw ñi ñoom ñoo ñu war a jàppale ñoo war a jiitu si xeex bi gis ne feebar bi ñu mun koo daan waaye looloo tax ñu kontaan pour am partnership ak concerned youth of the Gambia for health ñoo xam ne ku leen jiite seen chairperson bi muy Mr Aboubacar M Kujabi ak seen spokesperson Wali Seen ñi nekk nañ i ndaw ñoo xam ne ndaw yu xarañ lañ ndaw ñu bugga seen réew lañ ndaw ñu bugga seen waajur lañ because soo gisee ñu taxaw gis ne ñoom dañoo jël problème bi def ko seen problème génn dugga si biir askan bi waxtaanat nit ki si seen through seen programme coordinator bi di Awa Jaasi kon ñun ñu la jaajëfal te ñu ngi ñaax askan bi koo xam ne bugga nga dimbale wala bugga ngaa dimbale ñoo xam ne ñooy xeex coronavirus bi ñii tamit nekk nañ i ndaw yoo xam ne dinañ bugga nga jàppale leen pour ñamit ñu ngi ñoo jàppale pour gis ne ñu àgga foo xam ne ñun mënuñ faa àgga te amuñ si lii rek ñu ngi def i programme si radio yi ñu ngi def i programme si télé yi te réeréewuñ bi tamit seen social media plateforme yi mooy Facebook bi mooy WhatsApp bi mooy Twitter bi yii yëpp i bunta lañ yoo xam ne ñu ngi ko jëfandikoo pour gis ne xibaari coronavirus bi loo xam ne mu ngi lëmbee àdduna loo xam ne xibaar boo xam ne lu jëm si naka la ñoo mun a fagaroo naka la ñoo mun a aaroo suñ boppa ak suñ kilifa yi si feebar bii nii loolu xibaar ñëpp jot ko te xibaar boobu noonu soo gisee ñu toog fii tey mooy pour jotali leen xibaar boobu noonu won leen ne coronavirus nekk na loo xam ne li am la te ñu ngi ñaax képp koo xam ne yaa ngi seetaan programme bi nga gis loo xam ne muy mandarga lu jëm si yaram wu tànga muy saxat bu amul dara wala ngay am jafe-jafe nokki wala sax nga am mandarga yu bees yu corona di wane mooy ne sa bakken bi mu bañ a mun a yëg lifin doo am xet loolu nekk na loo xam ne mandarga la te sa làmmiñ bi tamit dafa lewet loo fa def du saf dara loolu tamit yeneen mandarga yu ees la yoo xam ne coronavirus mu ngi ko wane kon képp koo xam ne jànkuwanteel nga mandarga yi ndax corona la ndax du corona loo war a def mooy nga daw call 1025 boobaa dinañ la digal loo war a def ba xam sa status su boobaa ñu test la nga xam su nekkee tam da nga test tamit bu ko xam sa result jarut ngay ñëw xoolal 1025 dinañ la jàppale pour gis ne test bi yomb na waaye foog rek ñun ndaw ñi ñu jàppa si xeex bi nii because gis nañ ne dëgg la léegi fu mu toll nii sax ubbi nañ jumaa yi ak jàkka yi waaye foog ñun ndaw ñi rek ñu yokka suñ kàttan ak suñ man-man pour gis ne jàppale nañ suñ waa dëkka astumala suñ kilifa yi ñoo xam ne ñooñu nekk nañ i nit yoo xam ne lu ko angale di waxee high risk people lañ i nit ñoo xam ne lañ feebar bi def leen yàpp torop te feebar bi daf dee nekk feebar boo xam ne daf leen dee toroxal daf leen dee sonal loolu tax ba ñu bari si ñoom suñ ko amee dañ si dee mun a ñàkk seen bakken te réeréewuñ biir aduna yëpp loolu fa xew te Gambia tamit bu mu fi dugga si ñum gën a faagaagal wala ñum gën a jël seen bakken si ëppa doole bi yëpp i kilifa lañ so maa ngi leen a jaajëfal di leen gërëm si seen taxawaay si suñ turi directeur Mr Modou Njie ak suma programme manager Mr Buba Dabo ñoo xam ne bëggoon naa ñu teew fi ñoom ñu sànni seen kaddu waaye ñu ngi si xat-xat ndi xam nañ si emergency lañ nekk fu mu nekk ni risk communication du directeur bi ba si suuf ñëpp ñu ngi xat ndig rajo yooyu ak télé yi ak béréb yi taskaay xibaar yi ñëpp ñu ngi ñu soxla pour ñu gis ne xibaar bi àggale nañ ko fépp fu mu war a àgga so si turi directorate bi ak Ministry of Health through suñ ministre bi Dr Ahmed Samate kon ñu ngi leen a jaajëfal man la seen xarit seen mbokka Jibril Gando Balde Senior Risk Communication Officer fii si Health Communication unit bi under the Directorate of Health Promotion and Education bu Ministry of Health maa ngi leen a gërëm di leen santa ba beneen yoon inshallah wassalam.
Before going further, I would like to introduce my colleagues here. I have my brother on my right hand side. Let him introduce himself.
Yes, as my brother rightly said, my name is Wali Sen. I am the spokesperson of Concerned Youth of Gambia for Health. We are a youth group set up basically to help the Ministry of Health in its fight against COVID-19. We realize that the ministry is doing tremendous effort to combat this disease, and we also want to show our solidarity with the ministry in coming up together, mobilizing ourselves to help them with sensitization. We realize that the key reason to fight, or the key aspect of fighting this disease, is to sensitize the people. And we as youths come up together to help the ministry in the fight against COVID-19. Thank you.
All right, thank you very much, Brother Wali. As we heard it from him, he is the spokesperson Concerned Youth of Gambia for Health. Next, before we enter into the program, we would like to introduce our sister next to my left-hand side. She will introduce herself.
Assalamu alaikum wa rahmatullahi wa barakatuhu, Gambia. My name is Awa Jasi, an executive member of the Concerned Youth of the Gambia for Health, and also a nurse. As an organization, we believe that it's not only the responsibility of the Ministry of Health to fight against this COVID-19. As individuals together, let's all fight this COVID-19. Thank you.
All right, thank you very much, my sister. That Awa, an executive member of the Concerned Youth of Gambia for Health. Today we are here talking to you with regards to the COVID-19 from the Medical Directorate of Health, Promotion and Education here at Central Medical Store. Today, before we go in further, I would like to tell you who is speaking, and that is Abubakar M. Kujabi, and I will be chairing this event. The Concerned Youth of Gambia, like I told you before, is youth organizations that came together as a result of COVID-19 with an aim and objective to participate in fighting against the COVID-19. Since the organization was established back in July 9th, 2020, 5 Islamic youth organizations came together with an aim to contribute to national development, because health is our concern, with our motto, and that is together we can fight for our health. Now, this organization are Muslim Youth Charity Foundation. We have Hamsadeen Ikra, and we have Islamic Knowledge Seekers. Unity Foundation is also one of them. and Al Huda Charity Foundation. So these are basically the three or five organizations that came together as a result, supporting the ministry in fighting against the COVID-19, that's the pandemic. Quickly, before taking it to my brother once again, and that's the spokesperson, I would like to give you a brief about the activities that we want to embark on during this activity or during this tenure. We would like to first get to the community. But then the first agenda that we established is that to talk to people directly via media, which we began. So far, we've met so many media outlets, the like of West Coast Radio, Taranga FM, Choice FM. These are medias that we have conducted our series of activities or programs in a form of sensitization, and we got a very positive feedback from the people. This is why today we are here at Kerr Fatou Media or TV in order to complete this media sensitization. And then from here, we'll be moving to the provinces. Before going further, I would like to allow my brother, the spokesperson, to take us briefly into the areas that we are going to attack after we have completed the mission of the media. Like in the provinces also will be, heading to there with regards to sensitization, but not only talking to them, but there are some things that we are going to take along. I would like our spokesperson to take you deeply into it so that the viewers can benefit it from there.
Okay, just like he mentioned, our chairperson mentioned, we want to help the Ministry of Health in its fight against this COVID-19. And we realize that youths are very, very important when it comes to issues of national concern. That's why we mobilize ourselves, just to remind you about that too. So one of the key objectives that we want to fight as youths is, one, is to effect a mass sensitization of COVID-19. We realize that there are still people that do not believe about the existence of this virus. We want to get to them wherever they might be, throughout the length and breadth of the country. We want to reach them and sensitize them, tell them about this COVID-19, and also do our best to help them with face masks as well as hand sanitizers that they could not afford. And another thing also is to promote the frequent use of COVID-19 measures, COVID-19 preventive measures. We've seen that people do not know how to prevent themselves about this COVID-19. A lot of people are having the face mask, but they don't know how to wear it. They have sanitizer, but they don't know how to use it. We also want to put that a part of our objective is to let people know how to use these preventive measures. And also another important aspect that they want to fight is called stigmatization. A lot of people have been infected of this virus and got recovered and are abandoned by the society. Like some people realize that one of their members was positive of this virus, and then since from then they know that this guy had a COVID-19, he was isolated. So we want to also help the ministry in fighting against this stigmatization of victims. That's also one of a very important role that we want to play in this fight. And also another point is to support the poor and needy families that are shockingly affected by this virus economically. We want to help families. If there is finance available, we want to help the poor and needy families who are in very remote areas of the country that are very, very affected of this virus. We want to help them. We want to help them and also provide them with basic food commodities so that they can also stay home. So just like my chairperson said, I want to take you through on areas that we want to go through. And if you look at it, there are areas that are called that are epicenter of the virus, meaning a lot of people have been infected on those areas. And there are also areas where people downplay the existence of the virus. And recently there was a community where some health officials went to sensitize them, and they were being chased by cutlasses and knives. So we want to also get to those areas and possibly speak to the head of those areas, the alcalos or imams, and see how best we can change the mindset. Probably, maybe as youth, they will take us more, more calm, and they can also heed to our advices, inshallah. Thank you very much.
Thank you very much, the spokesperson, Mr. Wali, for that brief update with regards to the activity that we are going to embark on during this campaign. It is very important for us to clear here before we move forward that this is a youth organization, and we've been working with the community for quite a long time ago, and some of us have been serving the community for quite 4 to 5 years. And seeing this pandemic affecting the community, I think we have to set our mind towards the community with regards to health. And most of us, are organizations that are, purely Islamic, and we believe that in Islam, there is a portion with regards to health. That is why we cannot leave the ministry, we cannot leave the media, we cannot leave the journalists, we cannot leave, the authorities that are responsible for this fight. But we have to join them as citizens of this country, as members of this nation, as youth of this nation, and we are the future leaders. In fact, this has demonstrated that we could be future leaders of tomorrow. And that is why, before going further, I would like to once again get to my sister, because this organization is not only making a sensitization based on our knowledge, but we have amongst ourselves some medical personnel who have the qualification of health area. Our sister is one of them. We would like to pass the mic to her, so that she can take us briefly about the danger of COVID-19 and some of the areas that we need to be vigilant when it comes to engaging in the public, as well as also some of the symptoms and things that we indicate that you have the COVID-19. Our sister will take us into it, and probably from there we will continue to some of the activities that we want to embark on during this campaign. Thank you very much.
Thank you very much, Brother Bakar. Well, okay, I would like to first talk about the proper wearing of masks and the safely removal of masks, because it's also very important to know how to properly wear the mask and also how to safely remove it. If you get your mask, it's important for you to first wash your hands before you wear the mask. After washing it, make sure you observe if the mask is not damaged, if it's intact. And then you can wear the mask safely. And after that too, before removing it, make sure you don't remove the mask in public. Make sure you go to a place where it's only you, at least bend down, and then hold the strips of the mask and then remove it safely, so that you will not infect other people or yourself. After that, I would also like to talk about the children. I think we always talk about how the mask should be worn by elders, and then we forgot about the kids. First of all, kids that are 5 years old and under, 5 years and below, it's not mandatory for them to wear the mask, because these kids, they won't know how to properly wear the mask, and also they might not be comfortable in wearing the mask as adults would be. So it's going to be very difficult for them to wear the mask. So it's only advisable for a kid that is 5 years old to 11 years old, and for that, there are some considerations that needs to be looked at before you give your child a mask. That is, if the child will be able to follow the rules that are given. Kids can only wear the mask, and that is maybe from 6 years to 11 years. They can only wear the mask if there would be an adult that will supervise them on how to properly use them. So I guess that's a very important point to also look at. And also for adults too, they should learn to wear it properly. If you're wearing a mask, you should make sure that it covers the nose, it covers the mouth and the chin, and the mask should not be a loose one. So all of these things need to be put into consideration before you just wear a mask and then infect yourself instead of protecting yourself. All right, thank you.
Thank you very much, our sister Awa, for that quick, brief demonstration, or I could say enlightenment with regards to the some of the prevention measures that we need to know when it comes to the COVID-19. And I think in our approach, what we have here, I would like to read it to the viewers so that they can get the clear picture on what we want to do during this campaign. One of them is that engaging both urban and rural settlements, as are the people that are living here in Greater Banjul area, and we will be moving to the provinces also. Among the activities that we are going to conduct, is a public demonstration of how to do hand washing and properly wearing masks. This is very important because still now, like this touch that aspect, but she didn't go deeply in explaining. But I know she will come back. So many people are using masks, but the way they are using it obviously is quite different on how one can wear the mask. So we will help them to to demonstrate it in a manner that they will be able to know. Like, for example, some people will use masks for 1 to 2 days without washing it. And this is why we advise such people, like, you use it 1 day, okay? If we told you have one, you can wash it tomorrow, you can take another one. If you can afford it, you can buy 2 masks and then you place the other one. Once you left for work, if you come back, you change that one for tomorrow, you wash it, and then take the another one that is the one that is clean. So this one will help you. But if not, you can only use 1 mask for 2 days. You might be infected without knowing. So this is also very important, and it will be some of the things that we are going to demonstrate to people. And also how to wash our hands. Some people, I think washing hands, you have to at least spend 20 seconds when you use this soap. 20 seconds according to the advice of the medical. So at least if you use it, you spend at least 20 seconds before you wash it. This is also very important. Mass distribution of flyers. When we are going to the community, of course, probably we cannot able to reach out to all the communities. But flyers, we believe that we can able to distribute it to many communities, and then they can extend it to others. And this is also very important. Giving face masks, yes, I have mentioned that one. And creating platforms of question and answers. This is going to be a very constructive campaign. When we get to the communities, most especially in the provinces, which we can say that they have a little privilege of receiving this information, we will have some platform there where people will be asking. We will be going with our medical expert from the Directorate of Health and Promotion and Education. These people will join us in the trip. Likewise, also our medical experts. So these people will help us able to answer those questions when the community, asks those questions with regards to the COVID-19. This is also part of our objective in this campaign. Encouraging people to get tested. This is also has been marginalized, I think, in this situation. So those who can able to get to the medical, they can test themselves if they believe that they are feeling or having some symptoms that are, let's say, similar to the COVID-19, because that is better than sitting like this, and this sickness is getting, more serious in your body. Explanation or explaining people the disadvantage of disadvantage and the health impact of stigmatization. Yes, stigma is very important because there are so many people who, I think the spokesperson has touched on it, but there is something that also we need to know that if you feared upon something, for example, if you want to fight with somebody and you get feared, that's 25% of he winning you. You understand? But if you don't fear, then you have a high hope that you can able to fight with the person. The COVID-19 or sickness also, if you are scared or or you're so afraid, probably you can have a high chance of having it. So this is also very important. I'm not a medical expert, but this is the advices that we receive from our video medical experts. So with that, we believe that we can able to contribute to the fighting of this pandemic, that's COVID-19. We all know, that, of course, that poverty has affected many people, much especially during this situation. So when we are going, we hope to go with a little token, like the less privileged people with regards to finance. We will provide financial support towards those people during this campaign. So I think I would like to pass the mic to my spokesperson. I think he has something to add on to that.
Thank you very much, Mr. Chair, for mentioning that important point. That is, the COVID-19 has caused poverty in many households in the Gambia. And this is the area where I would like to spend time and actually call on to all the philanthropists out there to participate in this cause. We are youths, and then we are doing this voluntarily. We want to help our people in the Gambia, as we are citizens, and they have nowhere to go for except to us. So that is why we mobilize ourselves to help our people in sensitizing them about this coronavirus, also helping them financially. And we know how important the diaspora are when it comes to helping out the poor and needy Gambians. The diaspora are very, very crucial in those areas. And a lot of GoFundMe accounts have been created, and diaspora Gambians have participated immensely in those GoFundMe. We haven't created a GoFundMe account, but we believe when we give our numbers out there, the diaspora could come out to our help and support us to fulfill our this needy cause. Not long ago, some diaspora Gambians who were residing in Bakote contributed an amount of $30,000, which was geared towards helping poor neighborhoods in Bakote to buy bag of rice as well as oil, cooking oil, for their families. And it was done rightfully, and the families were very, very happy. We want to do something like that also for the Gambia. So whichever amount you have out there, you want to help us to reach out to these families who are really, really affected by this COVID-19, please do not hesitate to call us in these numbers: 312-7570, 312-7570, and 368-9104, 368-9104. Any of these numbers you call, you will have either me or the chairperson, and probably we can collaborate in trying to help these people, because definitely they really need our help. I have met so many families, and they have told me that they are really affected by this pandemic, and some of them have started going out to people, which they've never done before, begging. And we really need to come to their aid. And we are calling on you, all Gambians out there and non-Gambians who wish to help, please do not hesitate to reach out to us on 312-7570, 312-7570, or 368-9104, 368-9104. Thank you very much.
Thank you very much there, Mr. Chair, the spokesperson, for that profound analysis with regards to the poverty that has affected many familyhoods in our country. And I think this is a very crucial area that not only the ministry, even the government, and as well as the philanthropists, the families are suffering. Definitely, we who are always working with the communities, we know how suffering these people are. Some people will even call us and tell us that, or even walk into the houses saying that we are definitely suffering. We cannot have even something to buy, food to eat. This is so sad. And these are our fellow Gambians. These are our fellow citizens. Okay? If some people are enjoying over there with their wealth, I think they can have a token to help this. And we believe with this initiative, together with the ministry, we will get to the provinces, and whatever that is going to transpire there, you guys will be able to capture it. You can see it, because everything will be put on media, and therefore we need your support, like this spokesperson rightly mentioned. And these are the numbers that if you want to call, if you want to contact us, you can reach out to us 3x3 3689104, 3689104. These are the contacts that you can reach out to us. Sister Awa, do you have something to add on to with regards to the stigma or about the face masks? Okay, before coming to there, I would like to encourage the youths because this work, this task, we cannot able to handle it alone. You know, the spokesperson, Mr. Wali, cannot do all these stuff because we are going, remember, we are going towards the countrywide. We are going to around the entire country. So therefore, we need youths. If you don't have your finance to support us, you can volunteer physically, you come and join us. We can help you, recruit you, orient you as to how we are going to take care of, because we have to equip ourselves when we move on to the communities. We know that we are going to face so many people. We know that the pandemic has spread all over the country. We know that we need to protect ourselves very well. Therefore, we have to take care of ourselves before we move, with the help and the advices that the ministry is going to advise us. And together, we are going to move with the ministry health personnel or experts who can advise us as we are moving along the way. That is why, brothers, it is not whether a Christian or a Muslim or a Christian or any effort. We would like you, as long as you are a Gambian, come and join us. We work together fighting against this pandemic. And then from there, we can continue our businesses. This is a very significant part. We need you. We need your support. Of course, when we conducted some of our activities at the various radio stations like Wage Quest and others, there are some youths who showcase their love and ready to participate. We've already captured their names, and we need you also, those who are listening right now, because we don't move yet. Probably by next week we'll be moving to the provinces. As of now, we are going to limit our activities within the Greater Banjul area. But then by next week, we'll be moving to the provinces. Therefore, if you need to be part of us, you can reach out to us quickly before the end of the week, so that we can help you, orient you, and then you can be part of us by equipping you and help you how we are going to face or be in the community when we move on to there. Sister Awa, what do you have to add onto this before we wrap up the program?
Thank you very much. Now I would like to talk about the signs and symptoms of COVID-19. We all know there are a lot of signs and symptoms, but we have the most common symptoms, which are fever, dry cough, and tiredness, which is always present in most of our COVID-19 patients. So apart from that, we also have less common symptoms, which are still symptoms of COVID-19, but it might look like other diseases. So, which is sore throat, we have diarrhea, we have conjunctivitis, we have headache, we have loss of smell or taste, a rash on the skin, or discoloration of fingers. All these are signs and symptoms of COVID-19. And once you start manifesting these symptoms, it's good to take actions immediately. One is by self-isolating yourself, and also call 1025 for medical advice. These people will tell you if they should send a vehicle to come and get you to go do a test, or maybe it's not really one of the signs and symptoms based on the other symptoms that it is associated with. And once you have this coronavirus, make sure you self-isolate yourself. A lot of people are scared that if they are positive, they might be admitted in the hospital or taken away from their family. It depends. If at all you are not having the serious symptoms, you might not be admitted. You can be asked to self-isolate yourself at home if it is possible. And to talk about the youths, like a lot of these youths are not taking this COVID-19 seriously, because most of them believe that it is not something serious, and a lot of youths are having it and they are recovering within days. So it's not something that they should be, scared of or, take actions. And I believe for us youths, yes, it's true, our immune system is strong. But let's think about the old people that we are staying with. If at all you have the symptoms, you are not self-isolating yourself, you might infect another person whom you know is having a weak immune system. He might be a young. It's not only old people that are dying. We have young people that are dying. So we should be very careful and then, follow the right precautions, help ourselves, help our family members, and let's all stay safe. Thank you.
Thank you very much, Sister Awa, for taking us quickly more updates about the some of the symptoms of the COVID-19. This is very helpful because I believe with understanding the symptoms, that will help you to identify or recognize that you are in a capture of the COVID-19 so that you can quickly get to the medical support. Much especially the numbers that you have mentioned, that's 1025. These are very important because whenever you call them, they can able to come for your aid. So now, I would just like to quickly remind you that this is the Concerned Youths of Gambia for Health. It's a youth organization that, different youth that combine different youth organizations in the country that have been operating in a form of charity and supporting or education, teaching so many youths in this country. We realize at this juncture that we need to stand up because the COVID-19, since we came to get into it since I think March, from March up to date, we've been receiving some. Then it wasn't dangerous like before, like this time. But right now, what we are talking about 96 because I saw the statistic today. 96 people died as a result of the COVID-19, and about 2,000 and more than 2,000 cases are identified in the country. That shows us that this is very crazy. It's getting higher and higher. And the areas that my brother or my colleague has rightly mentioned, the epicenter is of the COVID. We can call, you can see it in the Greater Banjul also, but in the provinces also, there are areas which are very serious. That is why we are calling all the youths of this country, irrespective any community you're coming from, or background or faith, come and join us, in this campaign so that we can together join in hands to fight against the COVID-19. And again, with regards to also support, because as you know, we are going to travel through provinces. We don't know when we are, in fact, when we are coming. We are going to face so many challenges along our way. Therefore, we need your support physically, financially, much especially those who are in the diasporas. You cannot be able to be in the ground, but you can, support us financially. And the numbers, like I said, is 3142757 3127570 3689104 3689104. This is the chairperson's contact. And the first one I gave you is the spokesperson. Through this, together we believe that the Red Cross also, we are calling their aid to come and join us, and we together fight against the COVID-19. We've realized also the poverty that is disturbing so many people here. With regards to the support that we are going to have, we will help the people. And I think if this one participated in this campaign, we can able to fight against this pandemic. Because there are some people during, much especially currently in the curfew and the lockdown, there are so many people who are suffering from, finance. They cannot able to have things to buy their meals, what to eat. So such people, if you approach them, you want to talk to them about this COVID-19, if you don't mind, they could fight you, okay, or they insult you. So we believe that if you come, our sensitization will be different, definitely, because it will go together with fun. We cannot able to help everybody because we cannot afford that. But those who can be privileged will be given that support. Therefore, we need everyone, every Gambian, every citizen of this country, where you might be, viewing us. We are calling on you. Come and join us fighting against the COVID-19. This is our national concern. It's not for the ministry. It's not for the government. It's not for anyone. If it is for that, we would have left them to go continue their work. But we realize that the ministry have been fighting for quite a long time. They cannot, eradicate this. So we believe that youths who secure the 60% of the population of this country, if they join together, help the ministry, together with the media, we can able to eradicate it. Assalamu alaikum wa rahmatullah. Bokk ñu seetaan fii ca Kerr Fatou. Ñun la Concerned Youths of Gambia for Health. Ay ndaw lañ wala sa mbootaay lañ yoo xamante ne dafa daal di boole ay mbootaay ndaw yi nga xam ne ñoo nekkoon di liggéeyal society wala community bi ba gis ne daal lépp loo xam ne dafa lamboo ci wàllu ndimbal ci charity wala sax lu wàllu ci wàllu seen diine dimbale leen di nga gis ne loolu moo nekkoon seen taxawaay waaye ñëw nañ ba toolu fii nii gis nañ ne dafa am loo xam ne dafa soxal suñu réew te moo di coronavirus bi nga xam ne defe naa ne dafa jommal nekkut ak Gambia rek waaye aduna bi yëpp su ko defee gis nañ ne toog nañ seetaan nañ bàyyi nañ suñu xel gis nañ ne ministre bi nga xam ne réew mi moom lañ sas pour ñu xeex wala jëwriñ bi nga xam ne ñoo ñëw seetlu wàllu wér-gu-yaram ci réew mi fii ñu ngi doon góorgóorlu ci ay weer yu passé yi waaye ba léegi mënuñoo daan feebar bi ni ci lañ gis ne ñun ndaw yi réew mi ñi nga xamante ne ñun ñoo magi ëllëg te ñu siicoo ci population yi Gambia bi mu toll ci téeméer bi ñu am ci juróom-benn fukk ci population yi Gambia bi kon ñun tam dañ am suñu wàlla waruñoo nekk ci leneen lu uutee façon yi parce que boo déggee di nga def yeneen programme dafa fekk ne wér-gu-yaram dafa am te ñuy gaañu ñuy dee ay suñ bokka lañ suñ ndaw lañ suñ bàyyi lañ suñ nijaay lañ loolu tax gis ne nañ ñun tam dañu am pour taxaw bokk ak jëwriñ bu ñu dénku ci wàllu wér-gu-yaram moo di Ministry of Health ndax ñu mën a ci booloo xeex jàngoro bi ñu mën koy daan su ko defee ku nekk daal di continuer kon mbooloo mi ndaw yooyu noonu bëri nañ nekkuñ ne benn organisation nekkuñ benn mbootaay la dem na ba tollu juróom ci ay mbootaay bokk na si Muslim Charity Foundation MYCF wala sax bokk na si tamit Hamsa Deen Ikra bokk na si Unity Foundation bokk na si Knowledge Seekers bokk na si Al Huda Foundation yii ñoo di ay ndaw wala sax ay kuréel yi nga xam ne dañoo bokk bugg a bokk ak ministre wala sax jëwriñ bu ñu dénk wàllu wér-gu-yaram ci réew mi pour gis ne daal mbooloo mooy doole buñ bokkee ak ñoom mën nañu daan mooy feebar bi ni te moo di coronavirus bi kon su ko defee li tax ñu ñëw fii nii ci Kër Fatou du jaas na ñu ngi fii nii ci jëwriñ bi nga xamante ne ñoo seetlu wér-gu-yaram waaye ñu ngi bokk jokkoo ak Kër Fatou tey ñëwal leen bugga pour wonal leen yenn si ay jéego yoo xam ne dañ ko bugg a tëral doxee ci loolu noonu bugga pour dem dugga ci population ci society ci community bi mun a wax ak nit ñi waaye tamit dina am lenn tamit loo xam ne dinañ ànd ak moom moo di ne ay face mask dinañ dem tamit ak li nga xam ne moom moo di hand sanitizer mooy lu ñuy jëfandeeku ci raxas loxo yi te dinañ wonal nit ñi nuñ koy defee bokk na si tamit moo di ne dina am lu ñuy gàkkaale yóbbaale ci wàllu xaalis ci wàllu koom-koom ñoo xamante ne ñoom dañ gis ne dañ néew doole ci wàllu am-am te ñu ngi dëkkee ci ñaaka ñooñu façon nit yooyu noonu nañ soxla ndimbal su ko defee kon ñun suñ campagne bi dafay uutee ndax dañuy demaale ak dara looloo tax soxla nañ ndax ñun ay ndaw lañ luñ am donc loolu la ñuy yóbbu waaye gëm nañ ne yéen ñi nekk dañu seetaan ngeen nekk foo leen munti nekk te ngeen nekk ay good Gambians nekk good citizens ay réew doomi réew yu baax ngeen gis ne daal opportunity baa ngi ni bi ngeen mën a dimbalee seen bokk yi ñun gëm nañ ne soo leen ñëwee ngeen bokk ak ñun ci lu leen yàlla dénk ñu ànda daal di dugga ci community yi population bi dimbale leen jox leen face mask naka noonu waxtaan ak ñoom ñi nga xam dañ jaaxle ñi nga xam ne dañ ragal dañ tiit ci wàllu feebar bi ñu dalal seen xel naka noonu tam lu ñu am lu ndaw ñu jox leen ko loolu gëm nañ ne suñ bokkee xalaat ñun yëpp ñu bokk benn jubluwaay ci lii nii gëm nañ ne dinañ mën a daan feebar bi te ñi nga xam ne dañ soona ñoom tam mun nañoo dalal seen xel loolu tax nombre bi nga xam ne ñu déglu bëgg na ñoo call pour dimbale joxe seen dimbal mun nañoo call suñ chef spokesperson bi nombre bi moo di 3127570 3127570 570 the spokesperson bi wala sax chairperson bi moo di man 3689104 3689104 yi moo di nombre yi nga xamante ne yooyu lañ ngeen mën a call man ñu am su ko defee ñu continuer ñu ngi am groupe WhatsApp boo xam ne dañ ko ubbi ndaw yu bëri ñu nekk ci réew mi fii nii ñu ngi bokk ci loolu te soxla nañ tamit ñoo xamante ne dañoo ñëw sol seen dala ànd ak ñun ci oto yi dugga ci biir community bi dem di waxtaan ak doomi aadama yi su ko defee loolu nekk na loo xam ne ñu ngi koy njaxtu jotoon na ñoo def yeneen ay jotaay ci rajo yi like West Coast Taranga FM ak yeneen Choice FM ñu doon oote dañoo gërëm ci liggéey bii nii bëri nañ te bokk na ci ay ndaw te ñoom tam dañu wax ne dinañ sol seen daala bokk ak ñun te loolu gëm naa ne suñ demee ba bokk nekk benn ba dugg ci biir community gëm nañ ne incha allah suñ ko daanut waaye dina nekk lu daw mooy des ñu mën a daaneel feebar te loolu ñëpp soxla nañ tam seen ñaan tamit dafa soxla because we need your prayers also is very important because the power of a Muslim is the power of a Christian is what is praying. So we need your prayers. If you cannot give us anything or if you cannot join us, we need your prayer. Gambia need to be prayed. We need to pray our country so that we can go back. So many people are suffering in our country. So we have to work very hard to make sure that, we join two hands together, especially youths who secure the 60% of this population. Bading all, mbal konton na, assalamu alaikum. Coming nga fono manik surwa kangola aning angale kangola kontol mu funding leti miliyalonko gambiano lem mbejanne ntartanun doko sifa jama be wokono ntartanun kamol makoy miliyalonko e blome ko ben dol bije ila dinol miliyalonko e babalo kambara ila dino e ma faham bake so nka conference fana organize le nka tale cleansing exercise katal jamongol place or miliyalonko public place woni jama kula miliyalonko aning banko sambar taran siloti abakonol so walatina say nga jele ko wala sa mamme kari tambala nga jele ko ni ministre nyin miliyalon ko wala marta jata kendiala kabiri nyin jankaro nyin sasa jawo nyin kabira dum tanan jang wal ba katakan ka kele pour ka boyndi bar han kabi ima keno so wala nan tol fana nga jele ko na sister sol na brother sol be batare no school fang mol man tratala karangola so fon tol be silan tol miyalon tol lem funding ko ke bulateng montumale nyim sasa nyimbe banna wala na nga jele ko organizational mitata fo lulu namely Muslim Charity Foundation, Hamsa Dini Ikra, Islamic Knowledge Seekers, Unity Foundation, Al Huda Foundation ñun lemul kafolti min nata e ke kilinti kaje ko dal dol fanam be ministry nyim makoy la kaje ko dal kanyin sasa jankaro nyin ka kele aybo ntol la banko kan nga jele ko kabir nga commencé mol jama be makoy kan fintitan tata nu radio station radio station jamal tata fo saba dol kan kilinan kabonang provinces ka fonye ko elafta kam makoy nyin doko la wala sanim bota jan tata je ibe makoy la fondinkel nag wolem tol jakaloti because fondinkel nyin wala nyanta kan tol makoy ka dung nyin kelo konon ka no nal nata ibajale ko albe makoy la berin tol fana mo fondin kellati natural tol fana na diata non se sino ka ñoo jube ten wala ka ministry nyin jibe to bara nga jele ko because nyimu riskren tol be dunna community kono malon fo dol mi yalon ko wolle be je community ya soto le ban fo ma soto bare ministry nyi be makoy la be advice la be dunno la nyaadi le community kono pour ka ke kilinti ka nyin jankaro nyin ka kele wala na mbal kililla alna alien makoy fe nombal nyim fele tam yalon ko momo lafta kana ka volunteer isen kolno wala ta yilafta ka ma korol ke isen kolno na spokesperson la nomba nyi walam 3127570 3127570 3689104 walam the chairperson 3689104 3689104 walam nombal timi yalon ko nali akili na lafta kana aliyam makoy nga dung ñing campagne kono alsena natara fana ilafta kam makoy fana banaya la karola o fana bundal ñimbel le fana walat nambal konton nambal jeyla alla jubere kendro aning fana anal la dual fana mi yalon ka tatanu kake alsea continue anala makoy lo fana inshallah be solan la all the time viewers to quickly wrap up the discussion that we are the concerned youths of Gambia for health. Our major concern is to fight against the COVID-19. Today we are here at the Central Medical Store from the Directorate of Health and Health Promotion and Education in collaboration with the Directorate of Health Promotion and Education. in fighting against the COVID-19. Today, we are hosted by Kerr Fatou, and we want to thank all the viewers of Kerr Fatou for their work well done that they are doing for this nation. With that, I will pass the mic to my colleagues, and they give their final words before we wrap up the program. From there, we can get to the last point that I wanted to share with you.
Yes, thank you, Mr. Chairman, for that update. Yes, just to conclude, I'm just thanking all the viewers for taking their time to listen to us, and also for all the encouragements we receive in the radio stations that we visited, as well as the people that are following us, because we have a lot of followers on social media, probably in WhatsApp. We have a lot of youth members that are also holding on to this. This is an idea that came on from the youths of the Gambia, who came together and said, we need to join the ministry in this fight. And since the inception of this idea, we've been working immensely to implement it, and now we are at the final stage of implementing this idea, inshallah. So I thank all the viewers for viewing, and also to Kerr Fatou as well for coming on to cover this. Thank you very much. And as we always say, one Gambia, one nation, as well as also a Gambia that is free from coronavirus. Thank you very much.
Thank you very much. To conclude, I would like to plead to the public to visit the health facilities when they are not feeling well. I think their health is more important than the fear of being diagnosed with COVID-19. A lot of people are sick, but they're staying at home, saying that if I go to the hospital, I might be diagnosed with COVID. And we all know that we're in the season of malaria. And it's not only malaria, but other diseases out there that are more serious than COVID-19. So if you feel that you're sick, please do visit the health facilities, because you cannot stay at home until the thing is at the last stage and then you want to go to the hospital. The nurses and the doctors cannot perform magic to cure you. So it's best for you to go to the hospital at the earliest to seek for medical help. And not only for the adults, but also kids. Kids are being sick, but they are kept at home, being given PCM and other medication, which can be harmful. If you're sick or your kid is sick, go to the hospital. Where it's COVID-19 symptoms or other symptoms, go and visit health facilities so that you can be taken care of. Your health is important. Thank you, and that's all I have to say. Thank you for joining us.
Thank you, Sister Awa, for taking us to that conclusion that everyone should be vigilant and be careful, much especially if you are feeling some symptoms in your body, because we all understand that malaria also is existing currently. So you cannot able to identify the two. Better you get to the medical support so that they can able to help you identify it. With that, this will bring us to the end of our episode. I would like to thank all the viewers wherever you might be following us. From me, Abubakar M. Kujabi, the chairperson of the Concerned Youth of Gambia for Health. And on my right-hand side, you have the spokesperson, that's our brother Wali Sen. And my left-hand side, you have my sister, that's Awa Jassi. Our Jassi, thank you very much. We are so pleased of having you here, because the analysis you have given us here, I think it's well beneficial. We're thanking also the cameramans, who are here, standing, supporting us, making sure that, you're hearing, you're viewing us clearly. Thank you very much from Kerr Fatou. Together with the Ministry of Health and Social Welfare, together we can fight the COVID-19. Thank you very much.
When we touch down, better broke down.
With Gamtel G-Fiber, now you can enjoy super fast internet in gigabytes. G-Fiber is affordable, stable, secured, and accessible to homes, businesses, and enterprises. With Gamtel G-Fiber, the future is speed. Gamtel, creating a brighter future in communication.
So she became mine and see the
nyilla domoro ka diata
boy jannon sikes restaurant
sa na ko be ni na dimbal nimbe domoro kala janno
domoro seneyata adiyata topotoro fanan kendema bije luntan during tamala abeka domoro ki janni adi manda wala de teka we bijele anim fanan ka fadi jang ikono e fa e ka fa minne ko pastry anim bakery iko fanan be kalele badde lomba conference lomba workshop lomba ye fo fendil lon dunia kono domoro betama nyillom international to wada number 1
amanke ba domola jandama
e sa domo jang is atariya
wo mu kubandi
sa na ko sa futandin
oto sa na ko be mu CKS restaurant
ndafa na janna mu yat ni manje dorom bijam
aban
CKS restaurant known for best quality food and customer satisfaction.
agada
mbijan aganya
albaka
mbaka important
yo nga transfer la sto
ya transfer la
ha code nyenje
okay what's nsila id soto
sa soto sorry agada
mbijan bro
albaka
mbaka
bara alla service o tariya
bare
mo ki janna nun kunu bara tariya
jannom yona forest de bureau gambia tonkon nano mbali ya bere birin koyna fo kato
bari si kodo kino kato nim fo bolon labe
56 branches mola soto gambia jam gambia kono ani gambia bantala bankol nko kodo kiya bele kodo sifa fo falindiro fo nyaadi lafta memmen na kodi to poto nin kodi maraw jannom number 1 ti nyonta andum fana nata anoda enterprise sotale wolam nyindi ko domorol fana kol fana be firale de dadi mani domorol dil fana beteata gambia dawda yalo ngam fa kendol sotale je
wo moyo diat
apelenta
baraka ni lafta nyelan kendol e binaji
yalo bu kanila ko la baraka ba
yalo ndel ciosano lo
baraka